Yeah, so the TOPP registry, we started the TOPP registry several years ago, and that's an observational prospective study which was conducted in Europe in 12 sites in 7 countries that were sarcoma reference centers, and additional 2 sites in the United States. In the registry, patients who were included were adult patients who had histologically confirmed diffuse TGCT in any of those centers. At baseline, we collected a lot of sort of baseline characteristics and prior treatment history, but at the baseline, we also assessed the type of the treatment strategies, whether it would be no treatment or whether it would be primary surgical treatment or systemic treatment. And then we prospectively collected information how that strategy changed in year 1 and year 2 after enrolling into this prospective registry. And we also collected patient-reported outcomes at baseline and also during year 1 and 2. So at CTOS, we presented with 2 data presentations based on this 2-year data from TOPPs, which complement the manuscript which was published earlier in the year. And that manuscript focused primarily on the baseline characteristics and the prior patient's journey from the diagnosis up until the entry into the registry. So those 3 pieces of data should be looked at jointly or collectively as overall evidence. So let me share with you a couple of data points that were presented at the Congress at CTOS. So first of all, the patients who were categorized as those who remained on the initial treatment strategy and those who changed the treatment strategy with either from observation to surgery or observation to systemic treatment were as follows. 79 out of 176 patients, so that's close to half of the patients, at baseline had no plans of any treatment. So it was basically wait and see approach. And at year 1 and year 2, most of these patients had no change in that treatment strategy. Very few patients changed that strategy from this wait and see approach to either surgery or systemic treatment. And most of them continued with the same type of observation throughout the year 1 and 2. The similar patterns were observed in a group of 45 patients who were treated with systemic treatment at baseline. And again, most of these patients remained in the systemic treatments in year 1 and 2, and only a few patients changed their treatments to surgery. And finally, in the 39 patients who were treated with surgery at baseline, this treatment modality remained throughout the time that the patients were in the registry. We also collected patient-reported outcomes data at baseline and in year 1 and 2. And in general, the pain scores and other patient-reported outcomes measurements were worse in those patients who had to change their treatment strategy. And this is not surprising because usually physicians seek a change in therapy and change in the modality of treatment when the current treatment no longer works or when the symptoms worsen. So this is not a surprising finding for us. But there are 2 pieces of information that were very interesting, even though the number of patients overall were relatively small. Numerically, the patients who remained on no treatment at all throughout the period of 2 years, and those patients who remained on the systemic treatment from year 1 to year 2 had higher quality of life scores than those patients who had surgery in year 2. Another piece of information that was very interesting was that those quality of life scores were numerically higher at year 1 for patients who remained on the systemic treatment comparing to those patients who switched to surgery. So why are these things important? Well, this is the first time that we can not only describe, but also illustrate in numbers the patient's journey in TGCT. Even though the number of patients who switch their treatment modality from surgery to systemic treatment or combination treatment was overall very small, this data suggests the need for multidisciplinary team approach. So it's important to not only continue with the same type of treatment, but involve multiple experts in the management of the disease. The data also emphasizes the chronic nature of the disease. At baseline, almost 94% of all patients reported complaints and symptoms due to TGCT. And at year 1 and at year 2, even if there was no change in the treatment strategy, the patient-reported outcomes remained the same, which again suggests that those patients throughout the entire 2-year period also remained symptomatic.